Great. Hi, everyone. Thank you so much for joining our webinar today. We're really happy to have you here. This is a webinar on the SOAR Act, the Supplemental Oxygen Access Reform Act. Our point of today is to have a lot of support in Congress for the SOAR Act. So this is legislation that ensures that anyone who needs supplemental oxygen can get the right type of oxygen, as well as enough oxygen and the oxygen services that they need. So at the end of the call, we're going to ask everyone to call your 3 members of Congress. So that's your US representative and your 2 US senators. We're going to give you way more information on how to do that. First of all, we want to give you some information, though, on what the SOAR Act is, and then how you can actually make those calls. Questions are going to be addressed at the end of the presentation, but feel free to ask any questions as we go. There is a question and answer button that you can click on your screen, and we'll be monitoring those questions, and we will be answering them towards the end of the session. Everyone should have received these slides. We will send them out again, as well as a copy of the how-to step-by-step guide for calling your members of Congress. That is in the chat. So participants can't use the chat. You've got to use the Q&A, but we have put in the chat those 2 documents. So as we're going, if you have any questions or if you want to reference those documents, you can just go to the chat. Our agenda for today, first, we're going to go through introductions and talk about our coalition. We're going to talk more about the background on supplemental oxygen. We'll talk about the SOAR Act. Then we're going to discuss making your 3 calls today. We'll have some time for questions at the end, and then it will be time to actually make your calls. So I want to talk about our coalition real fast. We do have a great group of over 30 organizations who have signed on in support of the SOAR Act. You can see their logos here. I will go ahead and say I don't think I actually introduced myself at the very beginning. I am Kate Gates. I am the Vice President of Advocacy and Programs with the Pulmonary Fibrosis Foundation. So many of you may have joined today because you're familiar with the Pulmonary Fibrosis Foundation, or you may have joined through the American Lung Association, American Association for Respiratory Care, some of the other groups on this list. It's so powerful that we have patients, healthcare providers, and industry who have all come together in support of this legislation. It really shows lawmakers that we're serious about it and that there's a broad coalition that have all agreed that this is really going to benefit the people who need supplemental oxygen. Our team today, as I said, I'm Kate Gates. We also have Erica Swart from the American Lung Association. She is the Assistant Vice President for Nationwide Advocacy at the American Lung Association, and Miriam O'Day, who is Senior Vice President for Government Affairs at the American Association for Respiratory Care. And I'm actually going to go ahead and hand it over to Miriam now to give you some more background on supplemental oxygen. Miriam, are you there? I can't hear Miriam. There you are.
I'm just unmuting and turning on my camera. So as Kate said, I'm Miriam O'Day. I'm with the American Association for Respiratory Care. The association represents the 130,000 licensed respiratory therapists and is very happy to be invited to collaborate with the Pulmonary Fibrosis Foundation and our Oxygen Coalition on this webinar. So we go to the next slide, please. Let's talk a little bit about why supplemental oxygen, and I guess you need to move forward on that slide. There you go. Supplemental oxygen is a critical treatment for patients with various lung diseases and also heart disease. So it helps patients maintain adequate oxygen levels, which is vital for overall health and quality of life. And there are a number of conditions that benefit from oxygen therapy: advanced chronic obstructive pulmonary disease, pulmonary hypertension, pulmonary fibrosis, patients awaiting lung transplants, such as those with alpha-1 antitrypsin deficiency, restrictive lung disease conditions such as LAM and PCD, congestive heart failure. And research has shown that providing supplemental oxygen improves outcomes for these patients, helping them live longer and also with a better quality of life. Can we go to the next slide, please? So how did access to oxygen therapy get so bad within the Medicare system? And how did that impact private insurance? So the Medicare competitive bidding process led to setting prices for medical equipment, and that included oxygen, even though we have always said that oxygen should not be part of the competitive bidding process. And what happened with competitive bidding is they based the reimbursement on the lowest bids. And the lowest bidders are sometimes the national companies that, because of volume, can come at a lower price, which put many of the independent oxygen providers, some of the smaller companies, out of business. And some of those smaller companies provided oxygen therapy to rural areas and to other patients that may not be serviced by the larger companies. So the pricing and availability challenges started to bubble up right at the very beginning. We heard about this. This had a huge impact on liquid oxygen system. Liquid oxygen systems are crucial for patients who require high flow oxygen. Because it's more expensive to provide liquid oxygen, this became unprofitable for oxygen providers. And there was also, very importantly, a reduction in respiratory therapist services because the oxygen suppliers could no longer afford to offer respiratory therapy services, leaving patients without the expert support that they needed. Can we go to the next slide, please? So what needs to be fixed to improve patient access? Many patients are now stuck with heavy, cumbersome oxygen systems that limit their ability to leave the house, and they also can't engage in community services. We go to the next slide, please. So the impact of oxygen starvation, which is medically known as hypoxia, occurs when the body or a region of the body is deprived of adequate oxygen supply. And hypoxia can cause severe consequences depending on the duration and the severity of oxygen deprivation. So what happens if you become hypoxic, if you're not getting the oxygen that you need from the system that you're using? You can have fatigue, you can have shortness of breath, you can have difficulty concentrating and sometimes confusion. You can have dizziness and lightheadedness or headaches. If hypoxia goes on for a long period of time, which we know that it does for patients who don't get adequate oxygen through the systems that they may be using, or if they don't have someone checking on them, like a respiratory therapist, to make sure that their system is working properly, you can have an increased heart rate. You can become blue, particularly in your lips or your fingertips. And in fact, you can have a loss of consciousness or organ failure. So the long-term effects of people who are not getting the right kind of oxygen through the equipment that they need, or the right levels of oxygen on the equipment that they may be using, is that they can have permanent organ damage and ultimately death. We know that this is a great reduction in quality of life and eventually possibly death. So let's go to the next slide, please. So liquid oxygen, what is it? It is a system that provides a higher flow. It's more compact. It's portable. We know that the number of liquid oxygen claims within the Medicare system has dropped now by 80% during competitive bidding. We know that physicians who have prescribed liquid oxygen to their patients aren't able to access liquid oxygen system many times when they're trying to prescribe them. And we know that the impact has been, again, within the Medicare system, about an 80% reduction in claims. And within private insurance, we know that liquid oxygen has become almost completely unavailable for patients who require high flow, and that the lightweight portable systems are almost non-existent within the Medicare and private insurance sector. So let's go to the next slide, please. We need to improve patient access, and we also need to improve patient access to respiratory therapists. In the next slide, please. So what do respiratory therapists do for patients who are on oxygen? They're the specially trained professionals who ensure that oxygen therapy is properly calibrated and that patients who are using it use it correctly. They provide essential support for managing chronic respiratory conditions. And as oxygen reimbursement rates decreased, many companies stopped offering access to respiratory therapists, leaving patients without critical support so that they can actually check on them, make sure that the equipment that they're using is matched properly with the disease that they have and the amount of oxygen that they require, to make sure that the pulse oximeter is reading properly and that they are properly titrated, as it's called. And the challenges highlighted in the images that you saw and the last slides underscore the urgent need for policy changes. And all of these policy changes can take place through the SOAR Act. And I'm going to turn the program back over so that we can talk a little bit more about how the SOAR Act solves these problems and should improve patient access to care and access to respiratory therapists. And thanks again to PFF for inviting me to speak on this webinar. It's my pleasure to be here. I'll stick around if there are any questions that come up.
Thank you, Miriam. I'm Erica Sword. I'm with the American Lung Association, and also want to extend my appreciation to PFF for hosting today, as well as being a wonderful partner in our efforts to pass the SOAR Act. So we're going to walk through a little bit about who the key champions of the SOAR Act are and what the legislation will do. Next slide, please. So one of the common myths is that right now that there's no bipartisan efforts going on in Congress. Well, the SOAR Act is a great example of that just not being true. And we're very proud of the very senior leaders and the bipartisan champions we have in both the Senate and in the House that are backing this legislation. In the Senate, you can see Senators Cassidy, Warner, and Klobuchar, three very senior, very powerful senators in the United States Senate. And Dr. Cassidy is also a physician, and I think that lends itself even a little bit more to the import of this and the recognition that this is a serious issue. On the House side, we also have a bipartisan group, and another physician, Dr. Larry Bouchon from Indiana, is also a co-sponsor or one of the original sponsors of the legislation, and is indeed a champion on one of the committees of jurisdiction in the House. We worked very hard to find a good bipartisan, bicameral group of champions for this legislation on the key committees, in hopes of making sure that as we were continuing to build support, we had the strongest possible leadership team at the top. And we're very proud of this group of champions for this legislation. Next slide, please. So in the weeks and months since the bill was introduced in the spring, we have, with all of your help and a lot of your good work, for those who have been already calling and contacting your members of Congress, we've added 2 new senators and about 18 new members of Congress, of the House, to this legislation on both sides of the aisle. And if you don't see your representative here, it is going to be time to make sure that they are called to the carpet, and we ask them to co-sponsor. So I don't think anybody has a perfect trio of co-sponsors, both senators and a House member who've co-sponsored. So all of us can make a call making a request to co-sponsor the legislation today. And a few of you who may have members of Congress whose names were on the last slide or this one have an opportunity to say thank you too. But we want to grow this list so that it is so long that we cannot fit them all on one slide. Next slide, please. So I want to talk a little bit about the 4 pillars of oxygen reform. And this is really first what the very broad coalition that both Kate and Miriam spoke of, that includes providers, patient organizations, and the oxygen supplier industry, came together around. And this is then, and if you look through the legislation, you can kind of see each of the pillars laid out in the bill text. But first and foremost, any efforts to reform supplemental oxygen in Medicare need to be focused on individuals who use supplemental oxygen. And we have known over the last 2 decades how important it is that that the rights of people who use supplemental oxygen are spelled out in that very legislative text, so that there is no question about the needs of the patient being paramount as part of the efforts to provide supplemental oxygen. And so that is our first pillar. Next slide, please. The second slide is around liquid oxygen. We know about 1.5 million individuals in the US require supplemental oxygen. It goes up a little bit, down a little bit, depending. But we know about an estimated 80 to 90,000. In addition to that, many of whom may be on the call today need higher flow, and that is all about liquid. And the only way to live the full and wonderful life that all of us want to have is to make sure that individuals who need higher flow of oxygen have access to liquid, including portable liquid. And if that is medically necessary, it is very important, and that is indeed a pillar to make sure that that is something that can be accessed. Next slide, please. As Miriam mentioned, we need to make sure that as people who need supplemental oxygen are at home or out and about, that they have access to a respiratory therapist as part of either getting their oxygen equipment set up at home, or if they have any problems with it moving forward or questions about how much oxygen they are getting. And we need to take out the ambiguity of whether or not an RT will be available to people who use supplemental oxygen. That needs to be part of this. And so what the legislation does is to provide and ensure reimbursement or payment to the oxygen suppliers for respiratory therapists' needs and services. And then finally, the fourth pillar has to do around standard documentation and also reimbursement for oxygen suppliers. We want to cut out a lot of the bureaucracy and the red tape that goes in about both prescribing supplemental oxygen as well as remunerating payment to the oxygen suppliers to ensure that they are indeed paid for what they provide. And so the fourth pillar of the legislation really focuses on that and creating a standard template that will be used across the country for prescribing oxygen, and then making sure that indeed people who need a supplemental oxygen access are getting it. Next slide. So all of those pieces and the pillars were written out, and Legislative Council in the Senate really worked very hard on turning those 4 pillars into a bill. And that bill is the Supplemental Oxygen Access Reform, or SOAR Act. And it'll be very important when you make your calls later today that you include the bill number. So please take a moment to write it down. In the Senate, it's S3821. And in the House, it's HR 7829. So when you call your senators, you're going to mention 3821. And when you call your representative, you'll mention 7829. And that's important. Unfortunately, a few other people thought that SOAR was a really good name for a bill. So we want to make sure that they're hearing from you about the correct SOAR Act, which is why we want to ask them to specifically mention S3821 or HR 7829 when you talk about the SOAR Act and supplemental oxygen. Next slide, please. So I'm going to turn it back over to Kate now.
Great. Thank you, Erica, and thank you, Miriam, for all of that great information. They've really done the hard work today of explaining the issue and then also explaining the SOAR Act. And I'm going to talk a little bit more about the logistics of actually making your calls. So again, who are you calling today? You are going to be calling the offices of your 2 US senators and your 1 US representative. So oxygen is managed at the federal level, so it's not managed at the state or local level, it's only at the federal level. So you'll just need to call your US senators and representatives offices. You will probably be talking to a staff person. It may be the staff person who has the health issue. A lot of times it's not. They can pass it on to the right person. And don't be disappointed at all that you're talking to a staff person and not the member of Congress. Staff are really key to making the decisions about this kind of legislation, really knowing the issues. And so it's so important to get your message to them, and they will pass it on to the right people. You may also need to leave a message so you can sort of think ahead of time if you want to sort of change things around a little bit if you are going to leave a message, but be prepared that you might need to leave a message for some offices. It's really important that you make the calls instead of just sending emails, which are helpful too, or sending snail mail, which unfortunately has trouble getting through anymore. So calling is one of the most effective ways to show that you're really serious about this, right? It takes more than the 1 or 2 seconds that it takes to send an email. If you make a call, it really helps to bring this issue towards the forefront of the attention of your members of Congress. Now is really a critical time. We're getting into a busy time, as everyone knows, with election season, that kind of thing. And so we've got to make sure that the SOAR Act stays top of mind with members of Congress. I'm going to suggest that before you make the calls themselves won't take long. It'll probably be the whole thing of actually making the calls should be about 2 minutes each. But before you do that, I would suggest doing a little bit of preparation. We again have the slide deck here, which gives you more information about the SOAR Act, and then also the step-by-step how-to on making your calls. Look through that, make sure you know what you're going to say. We're going to talk a little bit more about sharing a little bit of your story in a minute. So make sure that you're really prepared for the calls before you start. Again, the calls will probably only be a minute each or so, maybe 2 minutes. These aren't going to be long calls. That's not what we're expecting. It's not something where you're going to get to have a 15-minute discussion with someone like you would for a scheduled appointment, but it's still impactful to call and say, hey, I just want to make sure that you're remembering the SOAR Act, please co-sponsor. You do, though, first want to see if you already have a member of Congress who's a co-sponsor. We still encourage you to call them, because even if they've already co-sponsored, there's a lot going on right now, and we want it to be top of mind for them. When it comes up in discussions of what to be prioritized, we want them saying, oh yeah, I am a co-sponsor on this, and I keep hearing from constituents, and they really appreciate that I'm a co-sponsor. So all great reasons to call and say thank you. If your member of Congress is not a co-sponsor, then here is a suggested script. As I've said, we've sent the slide deck, and we also have in that how-to, the sort of one-page how-to step-by-step. These scripts are there, so I'm not going to read through the whole thing right now, but I do want to point out that you're going to briefly share your story. You want to have a couple of sentences. I really suggest jotting it down, saying, this is important to me because I've been diagnosed with COPD, and when I first got my oxygen, I had no idea what to do with it, and I was using it wrong for 3 months. Or it's because my mom had pulmonary fibrosis, and she wasn't able to go to the grocery or the doctor's office without help towards the end of her life, that kind of thing. Those are the kinds of things that you want to say. Again, it has to be short, so you want to think through beforehand, what are your key points that you want to get across? Same with the thank you. You want to have a brief little bit of personal information there to really get it to stick in their mind why this legislation is so important. So again, that's the sharing your story. What do you want members or staff to remember most about you? If they have any questions, you can go ahead and jot those down. We have a follow-up form that's on that one-page how-to document. We ask that you fill that out after you're done making your calls. Let us know how each call went. You can jot down notes so that you remember this office asked this office asked this office said yes, this office said no. You probably won't get a straight yes or no. They'll probably just thank you for your time, but we want to know any sort of feedback so that we can follow up as needed. And I think that is the end of the presentation. We now have some time for Q&A. I'm going to stop sharing, and then we can bring the other speakers back online. Miriam there as well? Great. Okay, we've got everyone. Thank you. So I'm going to go ahead and read through some of these questions. We have a few more minutes before you all go ahead and make your calls. One question, and maybe Erica, you want to answer this one. It's the 5-year contracts, right? So that DME companies get paid at the beginning of the 5-year contracts, but then towards the end, they're still obligated to provide stuff, but they're no longer paid for the rental of equipment. Does the SOAR Act address that aspect at all?
I'd welcome Miriam chiming in on this as well, but I think this is going to kind of upset the apple cart and provide an opportunity for people to go back to their provider to have a new prescription through that template for the type of oxygen, the modality that they need, whether it's more portable, more stationary, what kind of life will the person want to live, and they'll discuss and decide that with their provider. And so that is something that will all be in flux and really changing as it moves forward, just given the fact that this is entirely eliminating competitive bidding for the supplemental oxygen system, and that this is going to change a lot of all of that as well. Miriam, I'm not sure if you want to add anything.
I agree. I think that when the legislation passes, it's going to have a reset for the industry, and that we will see people changing the way that they do business. That's our hope.
And I will say that it does take, it's not going to be signed into law on October 31st and have the changes happen on November 1st, right? It is going to take, and there is a build-up period and other things during which time all of the transition will happen. And so we know that it is not going to be an instant overnight thing, but it will be starting to move in the right direction right away.
Again, that's our hope. Whenever legislation is passed, there's a rulemaking period that takes place, and our organizations will be watchdogging those regulatory rulemaking periods when they're open for public comment. We hope that we won't have to go through the ombudsman at CMS, which is what they've asked us to do to register any problems that patients are having with access, because that hasn't yielded any success for us. And if necessary, we'll go back to the members of Congress who have supported this legislation so that they can articulate in letters to the administration what the intent was.
We have a question here. When do we expect that the SOAR Act will be voted on?
So there's a tricky little thing. It is not the Schoolhouse Rocks approach to how a bill becomes a law. Well, we are hoping that that there'll be some attention from one of the committees that has jurisdiction over this legislation in the House. What we are really pushing for is to build as many co-sponsors as possible, so that when Congress negotiates an end-of-year deal, there's always a big, unfortunately, sometimes referred to as a Christmas tree, because everybody hangs the piece of legislation that they want on it, to have a big bill passing at the end of the Congress before the holidays, so that everyone can go home and have a lot of things wiped off their to-do lists. So we do not think that this legislation will see a vote up or down on the House or the Senate floor. What we are hoping to do is that we get enough enthusiasm, push, and support from all of you, and therefore your members of Congress, behind the legislation, so that it can move forward as part of a year-end Christmas tree package.
Yeah, Great. We had another question too, how many co-sponsors do we need? And there's not a set number of co-sponsors, it's about having enough support overall. So, the more people that we can get to call in and raise the importance, that's really the direction we're going with this.
The answer is always more.
Yeah.
How many more co-sponsors do we need? More.
More. Great. Someone is asking a couple of questions, should they call? I don't use supplemental oxygen, but I'd love to call and give support. Is it okay to call without a personal story? Yes, absolutely. If you've already called or you've already tried to ask your member of Congress, met with them before, what should you do? And they haven't signed on yet. What's the next step? Should you still call? Okay,
More
great.
calls, and ask your neighbor to call as well, and maybe another neighbor to call as well. So if you have been calling, getting more people who are constituents to call as well is very important.
Mhm.
Does the SOAR Act address the smaller POCs, or is it mainly just for liquid oxygen? Is it going to make any difference for people who need those, 1 or 2 liter per minute POCs?
You want me to take that, Erica?
Go for it. Yes.
So the specific form of oxygen that's addressed within the legislation is an add-on payment for liquid oxygen systems. So it does not specifically address the POCs, but with the patient bill of rights, patients should have a better opportunity and a better route to be able to register formal complaints and get the systems that they need. Also, with respiratory therapists being engaged in the system, those therapists can also advocate for patients when they've had a home visit with those patients.
Great. And I do want to acknowledge we're at time. We had planned this webinar from 2 to 2:30. We have so many great questions. I don't know, Miriam and Erica, if you have time to answer some more questions. If you need to go, I understand. If anyone else needs to go, please prioritize making those calls. I can stay on and finish a few more questions, but I wanted to thank everyone for joining and really encourage you to go ahead and make those calls. They are so important to getting us to have this past the finish line. And please do, if you have questions, put them in the Q&A. We can't, raised hands won't work because it's a webinar. We can't unmute people. So let's see. Does this only work for people on Medicare, or would it also help people with private insurance?
While this legislation reforms Medicare, Medicare has always provided the bulk of the market for oxygen payment. And so the experts, including the suppliers, but also some of the economists, estimate and believe, as do we, that by making sure that there is a steady a steady client, if you will, in this case, the federal government, with contracts for supplemental oxygen, that will also affect people who are not enrolled in Medicare, that have private insurance and have their insurance through other places. And so while this legislation deals with Medicare, we do expect it to ultimately reform the entire supplemental oxygen market. Miriam, I would welcome your thoughts on that as well.
I think that's a good answer.
Great. With the Medicare, the Bill of Rights, the patient's Bill of Rights, how is that going to work? How will Medicare respond? How will the DME suppliers, how do we anticipate that happening so that patients are actually getting what is in that Bill of Rights?
Miriam, do you want to take it?
No, I would leave that to you, Erica. I think that's really something that the ALA has championed on behalf of patients, and I tell you, I really respect and admire that's in there.
Well, we have definitely done this in conjunction with Pulmonary Fibrosis Foundation and the other patient groups, because we have just heard so many examples of the challenge for this. I think a lot of I think that this is something that we'll continue to see action taken and implementation by the Centers for Medicare and Medicaid Services as the legislation is implemented. I fully anticipate that there will be a place through CMS where patients can submit problems and questions, but I also think that this is an important opportunity, and the ability to first flag the concern with the oxygen supplier. And from there, to be able to take it to Medicare, beyond that. So that will certainly be something that will come as part of the implementing regulations, and other aspects, as the legislation is moving forward.
Kate, I saw that there was a question about the amount that respiratory therapists would be reimbursed with the SOAR Act. That amount has not been set. That is something that will be done through the rulemaking with the Medicare system. And so the respiratory therapist services, the secretary will have to go through notice and comment and rulemaking, the same way that they will with many components of any federal legislation that passed, but also with the SOAR Act. The other, I guess, excuse me, the other thing I want to add too, which is something that a question that's come forward is, will it be mandatory for the durable medical equipment companies to hire respiratory therapists? And it is not mandatory that they hire respiratory therapists. It's just that add-on payment is there, and we expect that they will, because now they can bill for it.
What are the committees that have jurisdiction on this legislation?
The Senate Finance Committee has oversight, and then the House, 2 committees have jurisdiction, although the Energy and Commerce Committee has kind of more jurisdiction than the Ways and Means Committee. Both are important, and you will see that among the Republican champions of this legislation, we have one from the Energy and Commerce Committee and one from the Ways and Means Committee for that very reason.
Great. I'm trying to see if there are any other, there's some that I'll answer on a person by person basis. Can you explain again why respiratory therapists used to be part of the oxygen service and are no longer part of that? I think you did before, but it's a little bit confusing how that happened.
Yeah, let me see if I can clarify that for people. So the durable medical equipment benefit is an equipment only benefit. It has never included a service component. And so for any type of provider to provide a service for a patient as part of the durable medical equipment, it's outside of that. So within the DME benefit, we are adding in a respiratory therapist add-on payment, something that has never been part of the system before. So the reason that there were respiratory therapists who would have provided service to oxygen patients in the past prior to competitive bidding is because the durable medical equipment providers would have paid them to provide services. They wouldn't have been able to bill Medicare and get reimbursed for it. As the margins or the amount of money that the durable medical equipment industry was able to earn from providing oxygen, as that shrank, there was no excess in the system for them to be able to pay a provider to be able to see these patients.
Great, thank you. And has Medicare been involved in the conversations about the SOAR Act?
Yes.
Absolutely.
And they both have formal ways, over the years. All of us have met with Medicare quite a bit to try to have them solve this problem first, to solve the problem of the lack of access to the appropriate supplemental oxygen, the lack of availability of RTs, and so they are certainly have been part of the discussions leading up. And then as part of the legislative process, they have been formally requested to review and provide feedback on the legislation as well. So Medicare is definitely a part of all of this.
Great. So I think we've answered most of the questions. There are a few more that we can answer separately. Anything else, Miriam or Erica, that you think we should let people know, or just go ahead and make your calls?
I would say make your calls today, make your calls in another week, and I have a great sticker that reads "Rise, Shine, and Call Congress." And truly, the best thing that you can continue to do is to not only be persistent with your asks to your 3 members of Congress, but to encourage others to join you and be just as persistent. And we are always happy to be a resource to you, any of our organizations, and individually as well. And we would really just, the squeaky wheel gets the grease, and we need the grease. So please keep calling.
Yep, great point. I see there have been quite a few questions again. You know, should I still call again? And don't worry about calling. Don't worry that you're calling too much. I mean, like, don't call 3 times a day every single day. But aside from that, you know, do not worry that you're calling too much. We need them to know how important this is to patients. Great. Well, Eric, oh, go ahead, Miriam.
I just want to say there was a question that came in about whether or not Teresa Barnes from the PF Warriors has been involved, and she is in fact on this webinar and has been involved with the SOAR Act. So I wanted to make sure that her fans out there knew that that she's part of this effort, and we're happy to have her.
Yep, absolutely. Great. Well, thank you, Erica. Thank you, Miriam. And thank you to all the attendees. We really appreciate you taking the time out of your day to listen and to make these calls. Please follow up. You should have received a number of emails from us. So if you have any questions, if anything comes up, please feel free to email us or give us a call if you have any follow-up questions.
Thank you.
All right. Thank you. Bye, everyone.